Here. And she caught up.
Presentation.
Okay, I suppose we should get started. So, got our continuing a discussion specifically about mastitis. We've kind of walked around that for a while, but we're getting specifically into that. So, lab next week or this coming Monday, Ricky Noto's coming in to walk us through how to test systems. If we can get, if our tri-plates show up, we might collect milk samples at the same time. We'll see if they're here or not. They were supposed to be here last week. They haven't shown up yet. So I'm not sure how long things are gonna be, but you're probably gonna bleed past 3, at least a little bit. So week after that, we've got hopefully some tours if I can get a van. The week after that, we'll be doing some mastitis stuff, and I think that takes us to the end of the semester. So I'll try to get that there. Showmanship, 5% of your grade. So you properly dressed is 1% or one of that 5. Calf fitted, calf trained is 2% each for those. So we're doing it, I believe, the morning. It depends on the accepted student day. I have to work around that. So we'll hopefully get everything what we need. So, questions or concerns? Don't know yet. It's probably gonna be in the morning, but we have to check it against the student, accepting the student day schedule. So it's not gonna be all that long. We've got 3 classes. So should take less than an hour. So mastitis causing bacteria. They fall broadly into 2 categories, environmental and contagious. So, does anybody have experience with these designations or not? Yeah, but a little bit of it. We might have talked about it, vet skills, but depending on what organism we're doing will affect how we go about treatment, how we go about prevention. There's a lot of overlap between the two. We go back to over and over, clean, dry, everything. Helps keep the bacteria down, but in an environmental group, we're looking at certain streptococci. So environmental strep is the way it usually referred to. Enterococci. Everybody know what that means? Entero means inside the gut. And then you've got coliforms such as E. coli and Klebsiella. So E. coli is everywhere, Klebsiella is everywhere. E. coli is one of the reference bacteria that microbiologists use. So you can find them anywhere. It's a question of whether management can put up a shield that keeps those bacteria from getting in to the teat end and causing mastitis. Contagious, strep should not be a problem on your farm. If you're doing the standard things that need to be done, strep ag is eliminated pretty quickly. It's also very sensitive to antibiotics. Staph aureus, contagious, but leads usually to chronic conditions. There's a lot of approaches. If an animal tests positive for Staph aureus, what do you do with her? And we'll talk about those things. And as we've mentioned before, mycoplasma is contagious and has a number of unique features that make it very difficult to deal with. So starting off with environmental. These are bacteria that are caught from the environment. They're always around. It's a question of numbers. So animals would probably fight off low numbers, but as those numbers increase, as the environment gets wetter, dirtier, question of numbers overwhelming the defenses of the cow become more probable. Contagious is caught from another cow. So you need some sort of continuation, some sort of movement of milk from one animal to the next. So that may be caused by the rags that we're cleaning with. I grew up, while I was a kid, there was a gentleman who worked in our industry or family for decades. He was very insistent on using the old rags over and over and over again. Those had to disappear when our milk inspector showed up. He'd have them out for there, but they're never going to fully dry. They'd be clean for the next one. It may come from a milking machine. It may come from the cow itself. So we talk about Staph aureus, you get in one quarter. Eventually, traditionally, with the milking machine design, that diagonal quarter would be infected next from an impact. So lots of different ways, bedding, rags, milking machines for that milk to move from one animal to the other. You can also have flies as a vector. Has everybody heard of that? Staph can be moved by flies from a calf If you're feeding a calf staph aureus milk and there's a lot viable there, the flies can go from the bucket or the nose of the cow to teat ends, and that staph can sit there for 2 years inside that teat and flare up when that animal calves in. So in all cases, we're looking at management as the barrier between bacteria and the teat end. And it's a balance, as we talked about in A&P, a balance of challenge and defense. So if we have a high challenge, we need a high defense to prevent that infection from occurring. And there is some thought that the somatic cell can get too low, and we don't have the defenses for any sort of challenge that comes up. I'm not sure I fully agree with that. Somatic cells can get there fairly quickly, but it is an open question, open to debate. So identifying bacteria. Historically, this is done with staining. And there are lots of different ones to help identify things. This is back in the days before we had the molecular techniques. You had a microscope, you had a slide, and you had these colonies. And on a petri dish, they tend to all look sort of the same on a standard generic auger. So is there a way we can differentiate them? So if we put them on a slide, we add some staining. How do they react to it? Do they absorb that stain or don't they? So that's how things were initially divided up. Gram staining is pretty much the most basic staining program. It divides the bacterial world into basically 2 groups. So you take some bacteria, you put them on a slide, put it under the microscope, you add some stain, and you see whether those bacteria absorb that stain. The bacteria that absorb or hold that stain are called gram positive. The bacteria that do not take that stain up or do not hold that stain are called gram negative. And the reason for that, we certainly didn't know that when they were first looking at this stuff in the early 1900s, the late 1800s, why there was a difference between the 2 bacteria. And it comes down to layers. So we have gram positive on the top. Those are the bacteria that are going to allow that stain to come in and color that bacteria in some way, shape, or form. So we have the green layer here is the plasma membrane. So that's the outer layer. And then you've got a protective coating on the outside that helps protect the bacteria from a number of different things. One would be changes in osmolality, giving some support, having an opportunity there to maintain a shape with that outer coating. With the gram negative, we're adding an additional outside layer. And this layer appears to prevent the gram stain from getting in. It also affects how these bacteria are going to respond to antibiotics. So if you've got that outer layer, you've got one additional layer of defense. So that sort of divides the microbial world into 2 categories. Those with 1 outer defense beyond the cell, those with 2. Or, well, gram negative, there can be a lot of reasons they don't hold stains, but one of them is the stain can't get in because of that extra layer. So the reason we want to start to identify is identification should direct our treatment. At least we hope it would. So given what we have, the gram positives, at least on paper, respond to antibiotic therapy, particularly that of the penicillin type or penicillin family. So if we want to get rid of them, we're going to use penicillin. Those gram positives should respond to that. The gram negatives will not respond to or will not die because of penicillin. So standard, most of the intermammary infusions are penicillin based. None of these E. coli, Klebsiella, mycoplasma are going to respond or die because of penicillin. So there's no point in using a penicillin based antibiotic if we're dealing with gram negatives. Our best hope and general approach is to do some sort of supportive therapy. You're treating the symptoms, trying to make the animal as comfortable as she can to allow her, if she can, to clear that infection on her own. So trying to help her help herself. So the gram negatives, the group, have that extra outer membrane, acts as a shield. So penicillin-based antibiotics do not kill, do not work. The idea with penicillin, it's going to disrupt plasma membrane, it's going to disrupt the peptoglycan layer. So it's going to disrupt the outer shells, the outer layers of these animals. If they are now continuous with the environment, they're going to die. Whereas even if you disrupt those two layers of the gram negative, you still have this outer membrane that's going to hold that animal intact until that penicillin kind of washes away. So animals that fit into this category that do not respond to penicillin and have that extra outer layer are coliforms, E. coli, and Klebsiella. So they have that extra outer layer. Mycoplasma is gram negative, but it doesn't have that extra outer layer. It's more like an amoeba and just is able to fix things faster than penicillin can destroy them. So environmental, you're not dealing with contagious between cows. So if you don't really need to segregate the animals, and we could say it occurs because of poor bedding. So you have lots of bacteria at the teat end. Beds are not clean and dry. We're going to have a challenge that exceeds the animal's defenses. We may also introduce that by hosing down the parlor while cows are still in it. We may have issues with a number of different things getting to those teat ends, dirty feet rubbing against the teat ends, anything that can introduce there. So coliform mastitis usually is an acute mastitis. It comes on real strong and drops pretty quick. Doesn't usually last for a long time. Clinical signs of that coliform mastitis, you're going to be a 3 level very quickly. You're going to have abnormal milk, nothing that you've even considered drinking or eating. You're going to have that swollen quarter. You're going to have a fever and sunken eyes as those coliforms are ripped apart by the white blood cells. They're going to release compounds that make the animal feel very bad. So it's almost worse that the E. coli are engulfed and ripped apart and those parts are released than if we had just let them go. Because it's the contents of that cell that are going to spike that fever, that are going to lead to that dehydration, to lead to the desire, just I don't feel like eating, I don't feel like drinking, I don't feel like doing anything. So that depressed affect. So as we said, the white blood cells ripping apart Those coliforms are going to release endotoxins, the contents inside of the cell. Those endotoxins are going to lead to those reactions that we described before. Going to spike a fever as those endotoxins flow through the body. You're going to have a lack of desire to eat or drink. With those two things going away, dehydration is certainly very rapid. Eating, you're going to lose energy, nutrition. You're going to have to start taking things from reserves, the liver, body condition to help the animal through. Water generally swells and the milk becomes watery on some level. So prevention, clean, dry comes into play again. So we're trying to get our bedding, our environment clean and dry. We don't want to have T-dens exposed to that manure. Pre-dipping is going to help clean off that teat. A clean teat, less likely for those bacteria to work their way into the teat end or be with liner slip impacted onto the other side. Post dipping is going to put a temporary shield there to allow that animal to be able to move back into her environment. Her teat end is not fully closed. That teat dip there should kill anything that comes close. So getting that teat dip on before they're exposed to their environment again. So certainly if we're going to spray down the parlor, we want to do it after all the animals are dipped. Then that should slow down the possibility of the coliform mastitis getting in those open teat ends. Short-term fixes, we think about lime in the stalls real quick. So lime is going to dry things out. It's going to make the environment not hospitable to bacteria. So we talked about, does everybody remember the bad bacteria speech? Things bad bacteria on the farm need. They need warmth, water, to live in, to drink. They need food. They need air, generally, and they need no irritants and inhibitors. So lime has the double whammy. Of getting this and providing the irritant to the environment. So both of those will slow things down. If you're going to prevent it over time, you got to think about cleaning your barns. You need about stall management. How am I going to make sure that the bedding underneath those cows, especially the udder, is clean and dry, not full of bacteria? So sand bedding, that's going to be, at least when we initially put it in, there's nothing there. There's no food for the bacteria to grow on. They're not going to populate. That'll keep the numbers down. If we don't clean that sand bedding, you're going to get the organic matter mixed in from the manure, and you're going to have the growth. Stalls, if we're putting on sawdust or straw or something, we've got to turn that straw over on a regular basis. So we're pulling the stuff that's wet and soiled off of the stall. We're either putting new stuff down or we're rotating the stuff in the stalls. Does anybody do that rotation? For whatever reason, I guess it's just convenience that we go in the morning. I was working at Michigan State, trying to earn some food money. Going in for the 3 a.m. milking shift. The first thing we did is we let all the cows out from the tile stall, we did a heat watch, and then we basically cleaned all the stalls. So you were scraping off all the back stuff. That usually ended up in the gutter to help absorb the liquid, so the barn cleaner worked better. And then we took the stuff from the front, well, 3 days a week you lined. Then we took the stuff from the front, we put that on the back, and we put the new stuff in the front so it would work its way back. So basically every day the sawdust in those stalls turned over completely. So, is it best to put the stuff that was under the front of the cow underneath the back of the cow? Probably not best, but it works better from a movement standpoint. Stuff goes in the front, we work it back. And then it ends up in the gutter. But if you could put the new stuff on underneath the udder, move it forward, probably work as well. The hard part is the stuff that's moving forward. Bringing that back can be a challenge while leaving the fresh stuff on some level. So again, positive, negative treatment. If you're gonna go for a treatment, you have to find an antibiotic, intermediary antibiotic that's specifically labeled for gram negatives. Amoxicillin is one of those. But most of them, if you read the labels, and we'll get to do this next week, they say, well, I'm sorry, we don't do gram negatives. Has anybody ever discussed that with you when they sell you the intermammary infusion, which ones they'll do and which ones they won't? It's right there on that label, the thing we use to kneel on, whatever that comes in the big tub, right? The instructions and stuff, but if you read the instructions, it'll tell you what they can and can't do. So if you suspect coliform mastitis and environmental mastitis, you want to treat, you have to find something that's going to work, something that's going to move through and affect those gram negatives. Penicillin based will not. So Pursue is an example of that. It will not do. So IV fluids, especially hypertonic saline. So we're trying to fix the dehydration. We can either sit there, as we said, with a very large container of saline. It looks like a 5-gallon bucket. Is everybody waiting on one of those with a cow? 5 gallons sterile, 5 gallons of sterile saline. If they're not moving around much, it's okay. Otherwise, it doesn't go, 5 gallons does not go through an 18 gauge needle fast enough. Probably the best way is get hypertonic saline, and then that triggers the brain to say, I need to drink a whole lot. So allowing that animal to flush herself. And then we take those coliform mastitis, the endotoxins get pushed to the kidney. We get more fluid through the kidney, and those endotoxins get pushed out in the urine. So the sooner we can clear those endotoxins, the better off the animal's going to feel. Given the fever and inflammation, antiprostaglandins are a good idea. The swelling, the pain, aspirin. So frequent milkings is something you see quite often. I know once or twice we tried to do it, not with oxytocin, but gangrene mastitis. When I was a kid, we had a real expensive cow. My mother was going out every few hours trying to milk that gangrene mastitis out. The frequent milking, the oxytocin, you're trying to flush the bacteria out so the white blood cells have less to fight. So you're also flushing out the white blood cells as well, the somatic cells. Whether we do it or not many people will make an extra trip to milk that animal like every 3 hours or every 6 hours. But what are we trying to do? If we assume that there's one E. coli, assuming ideal conditions leads to a doubling every 20 minutes, how many bacteria do we have after 2 hours, after 4 hours, after 8 hours, or after 12 hours. So doubling, 1 becomes 2, 2 becomes 4. Ideal conditions, inside the udder is pretty ideal for E. coli. It's got all the nutrition it needs, it's warm, it's wet. There's probably enough air in there to get things done. If nothing else, they can steal oxygen from the tissues. There's no irritants and inhibitors except the white blood cells. So any guesses of how many we'll have after 8 hours? Well, this is the progression. We start out with 1, then we're working our way down to 12 hours. So what is it? The most powerful force in the universe, I think Einstein said is the compounding of interest. This is the doubling effect. So frequent milk out, after 4 hours, that 1 bacteria could be 4,000. The doubling rate. After 8 hours, we're at 16.7 million. After 12 hours, where we have 68 trillion bacteria under ideal conditions. So the idea behind that is we're reducing the bacterial load on the animals. It's easier for the animal to handle this challenge than it is this challenge. So that's the theory behind it. I don't know many people that do it. I know it's continually recommended. I'm not really sure. I understand the theory. I'm not sure. I think it just comes down to I don't have time to do it. But if we can reduce that, completely flush out the milk, we should be able to reduce the bacterial load the animal has to deal with. So switching over to gram-positive, we're dealing with that lack of outer barrier. So you got 1, not 2. So we've got that difference there. Block this outer membrane there that helps protect that animal. Also, evidently prevents the stain from being absorbed. So these tend to be very responsive to basic antibiotic treatments. Penicillin is a very formidable enemy to gram-positives. Our strep and our staph species, we certainly use those a lot in human medicine, but we're dealing with things like MRSA, like the amoxicillin resistant Staph aureus. Those to me have been fostered by the medical industry, people to people, not the use of antibiotics on farms. So, but there's a lot of people that don't fully understand things that are pushing them to be penicillin not to be available on farms, except in vet prescribed cases. So the ones we'll focus on in this group are strep animal and Staph aureus. You'll also have the strep species, but normally we're thinking about these two. They are also contagious when we're thinking about these two. Strep species are environmental. So we'll do a grid as we go forward here where all the animals end up from a environmental crossed with gram staining at some point. So prevention of contagious. We're trying to prevent the milk from one animal getting to the next animal. So proper milking hygiene, making sure we're prepping those teats, we're focusing on clean, dry teats. We don't want water coming off the udder. That's the way it used to be. You had to wash the entire udder before you milk the cow. When you only have 10 or 12 cows, that's doable. When you have thousands to get through, you're not going to sit there and wash every udder completely. And then you get that teat coming down. So we want to milk clean, dry teats, well stimulated as well, but the prevention of contagious focuses on the clean, dry. They used to go through and back flush milking machines. So you could have a system, you turn a valve that would back flush with sanitizing solution. That not really shown to work as well as it might. You're going to add a lot of water to the milk and sanitizer to the milk. That's probably not the best way to go, but it does crop up every once in a while. We want to make sure that we have our machine operating correctly, no liner slips, no cracks or leaks that are going to influence that liner opening and closing. Making sure we get a good clean milk out. So proper dipping, if we do this, strep ag just tends to go away. So pre and post dipping. Dry cow treatments are gram positives are very susceptible to our dry cow treatments. So preventing that infection or treating that infection in our dry cow treatments, we have a higher dose. It's in there for a longer period of time. So kill for bacteria is, I think I mentioned this before. So how much anything will kill is a function of how long is that antibiotic present and what concentration it is. So the longer, the stronger the exposure, the more likely it is to kill things. So that happens with our dry cow treatments. In fact, most recommendations these days, if you want to get rid of them, don't treat during lactation. Treat when you dry off, and you should be able to certainly get rid of the strep ag. Staph is another one, and we'll talk about that independently. Gram positive, especially our Staph aureus cows, they tend to be reinfected over and over again or chronically infected. If that animal's not producing, she's always got high somatic cell count. There's a school of thought that we cull those. There's another school of thought that if we cull that animal, another one's going to pop up in her place. So we really haven't gained anything. We can manage her, feed her to calves or something. Maybe there's some benefit to having her around. So gram positive, we want to culture. We'd like to know which gram positive it is. Strep ag can be successfully treated with antibiotics during lactation. This is the only bacteria that falls into this category. Everything else, the antibiotic treatment during is pretty debatable. Dry period more successful. And we know that most treatments will not even work on certain bacteria. So you've got a whole class of bacteria that standard treatments don't work on, so there's no point in treating them during lactation. And then you've got a few where you don't usually clear things up. So Staph aureus has about a 50% cure rate. Does anybody know why their cure rate is so low with Staph aureus? Why Staph aureus is chronic? Strep bag is Staph aureus. You put them on a plate, they will die pretty quick with penicillin. It's the behavior of the Staph aureus and the way it colonizes that make it so difficult to cure. So we need, usually with Staph aureus, we need a higher dose, and that comes with dry cow treatments. So gram positives. Need that intramammary antibiotic treatment. If you have them out on a plate, they will very much respond to that. The challenge is that staph cows will exhibit some morphological changes that make it very hard for it to be treated. So identifying directs treatment. So if we're looking at this chart here from the University of Wisconsin, we have some of our strep positives. Staph aureus, contagious. Strep ag or strep agalactia is contagious as well. Natural infection, if we don't do anything to intervene in both of those cases, is going to be long. The body has a hard time clearing those. The other has a hard time clearing those. What you're going to see most of the time with strep ag is just decreased somatic cell. You're not going to see a 1 mastitis, a 2 mastitis, or a 3 mastitis. It's just going to be in that 4, 5, 6, maybe 7 linear score, maybe a flake here or there, but she's not going to show any real clinical signs. And that's because strep ag doesn't really attack everything as aggressively as some of the other types. We see that strep ag tends to colonize on the surface of the ducts, on the surface of the secretory cells. Being on the surface, if we can get the antibiotic to where they are, what would be the challenge of getting it to the circulatory or secretory tissue? I do an intermammary infusion of an antibiotic. Where's the secretory tissue? Where's the secretory tissue in another? It's up high. Just put it down in the teat cistern. Is that antibiotic going to work its way up through all those ducts to get to the secretory cells? Especially if milk is flowing in the opposite direction. There are a lot of people that will try and massage it up after. Has anybody seen that? Especially the old timers, right? I don't want the antibiotic to stay down in the teat end, teat cistern. I need to force it up in this area. And that's not going to happen too naturally, although the cow moving around is going to move things. The direction of flow is down. I need to get up there. But any of the strep ag that colonize the surface are going to, once they run into, they're going to be very much wiped out. This is one of the cases, if you've got a tank, you got a tank that's like 700,000. They come in, they said your herd is contaminated with strep ag. The general recommendation is to treat everybody and dump all your milk for the next 2 days. You got a 90% cure rate during lactation. You should be able to get rid of that strep ag. This is the only one that really responds in lactation therapy, antibiotic therapy. In contrast, our Staph aureus, there'll be clinical cases. There'll be cases where you've got some swelling and things like that. There'll even be cases, has anybody seen a situation where the udder blows out from the side? You got this abscess that all of a sudden blows out. That's the Staph aureus walling itself off, creating micro abscesses inside the secretory tissue. The Staph aureus, once it's established, walls itself off. And because it walls itself off, it is not amenable to antibiotics. It's basically built a wall or a moat between it and the antibiotics, and it's very hard for those antibiotics to cross that tissue. Those micro abscesses will wait till the cow's immune system is suppressed, and then they'll burst or flower. So you usually see an eruption when the animals are sick or when the calf. We get that long-term infection. There is some school of thought with Staph aureus, if I can identify it early and get it before it digs in like a tick. There is some people that use shock treatment, doubling up antibiotics. We're doing 2 courses of antibiotics, trying to prevent that Staph aureus from getting a foothold in establishing a chronic condition. So, new infections, you can go pretty good. 2/3 of them you might be able to get fixed before they burrow in, but we're looking at 1/3 that are just going to stay there. So it depends on what your economics is with that cow. How bad do I want to keep her around? What am I willing to do? Talking to your vet about extended treatment, so increasing the time or possibly doubling it up. Either way, trying to increase the kill function of the treatment that you're dealing with. The chronic infections, not much you can do, even with a dry cow treatment. Once they're established, that quarter is pretty well infected. And that's because everything gets walled off, and sometimes those walls, they burst up. Sometimes the easiest way for them to escape is through the side of the udder. So we have some other gram positives here, but they fall into the environmental category, so strep species. And we'll show you once we get our, what would you call those, the manuals. We'll show you all the pictures of the different ones. So depending on the circumstances, their duration is variable. You're going to see clinical cases and increased somatic cell. So subclinical mastitis and a clinical mastitis. Again, we've got on the surface, but again, not the best cure rates, or not as 1 in 4, 7 in 10 is not the ratio we'd like to see for cure rates. We'd like to be a little bit more successful, especially if we're doing it during lactation. These are going to be, they don't wall off like strep uterus. On the surface, they're going to respond better to the dry cow treatments. So identifying these animals, and if you're doing selective dry cow treatment, these staph cows, these strep cows should be put on that dry cow treatment to at least knock everything back as much as you can, reduce everything as much as you can. So the other half of that diagram, we have our gram negatives. So we have the coliforms, E. coli, Klebsiella. They come from the environment. They tend to have a very short duration. If you do absolutely nothing, odds are it'll be gone in a day or so. Question is, will the cow survive the symptoms that are caused? So we have to support that cow any way we can. You might end up with some systemic stuff, bacteria in the bloodstream as they bust through. You got mild to severe clinical mastitis. 85% of the time, if we do nothing related to the bacteria, no intermammary infection or anything like that, 85% of the time, the cow will fix her own thing there. We'll stop there and talk about Flagellato's negative staph species and Mycoplasma bovis next time.
It's not a big deal, I don't care. So I left the farm and I was in a rush. It's not a big deal.
Thank you, sir.
At some point, I don't know, when these move for you, when you go over some stuff. From Monday, this is a project, I guess, those are.
Well, I guess the question is, do you want to get started? And that doesn't seem like something you'd want to